I think that's a really interesting question because we've got a wealth of different treatments to give. I mean, in a frontline setting at the moment, we've got 4 or 5 choices that we need to make. And that's actually quite difficult, not only as a doctor, but for the patient to sort of take on board, and how do you frame that for that? So I think when you think about treating a patient, you've got to think about them, you've got to think about their disease, and you've got to think about what suits their lifestyle. And those are the 3 things I do. Let's think about the disease. I think certain types of CLL benefit from some treatments more than others. So if you've got a P53 disruption, I think the community generally thinks longer term treatment is best, and we generally give that as BTKI monotherapy. If we think about a patient, I'm thinking about really if they've got any other medical conditions or some reason why one treatment might be better over another. So for instance, you can see quite significant cardiac side effects with some of the BTKIs. So I think patients who've got a significant heart history is probably not the right treatment because you've got other things you can give. But ultimately, though both of those things are really important, actually the most common thing is actually what suits the patient. Do they want to go onto a therapy for a fixed time? Do they prefer to be on a therapy for a long time? Do they want to have lots of visits to the hospital perhaps to start with, but actually later on that means that they are off treatment altogether and don't really have to have very much medical contact at all or hospital contact at all? Or would they rather go on something which they just take daily, which is easy to monitor and things like that, but the likelihood is they're going to have to continue to interact with a hospital in a way? Are they happy? Do they want their treatment? Do they want their CLL to sort of completely go and not bother them at all? Or are they happy to know that it's there but we're controlling it well? So I think those are the kind of things I think about when deciding treatment. It's quite complicated.